products and treatments has surged, resulting in a 50% increase in sales in 2020. But with a vast array of options available, many are left wondering how to determine the best solution. For more on this, we're joined on the KCBS Ring Central Newsline by Dr. Dina Strachan, New York City board-certified dermatologist and director of Aglow Dermatology. Thank you for joining us.
My pleasure.
So first of all, explain what exactly is hair loss, and is it all according to our genetic makeup, or are there other factors?
So hair loss is basically when your hair starts to fall out or you grow less hair, and it's much faster than just genetic. Androgenetic alopecia is what we think of when we think of as hair loss. Male and female have hair loss, but there are many reasons for hair loss.
All right, let's talk about some of those reasons. People say, oh, I'm tearing my hair out, I'm so stressed. Stress, does that factor in?
Stress does, but it often becomes a wastebasket when one hasn't figured out what is actually causing someone's hair loss. So usually it would be life-threatening stress, like a plane crash or something like that, that would actually be responsible for hair loss all by itself. I think it's important before you blame stress that you check for other things.
And some of those other things are?
So you would check for ticket history. Hairstyling practices could be a common cause of hair loss. Traction alopecia, CCCA, which is central centrifugal cicatricial alopecia. You might want to check on people's diet. Did they lose weight? Did they have surgery? Did someone just give birth? You might want to check their thyroid disease, like what medications they're on. Does the person's health history make them at risk for hair loss? Like, do they have lupus? Things like that.
All right, so let's talk about some of the things that can reverse it or stop it, or, well, you explain. There's medication. There's also different therapies. What's available?
So, we are long past the time when you could recommend to someone with a growing or a hair transplant. Number one, you need to make sure you diagnose someone's hair loss, because the treatment will be based on what's causing the hair loss. That's very important. But, in terms of things that generally work in terms of reversing hair loss that can be helpful regardless of the type of hair loss, of course, most people are familiar with minoxidil, which is, known by the brand Rogaine over the counter, which can be very effective in helping hair loss. And, there's a little more popular in taking the oral version, which is more bioavailable to some people. So there is some concern because that is a blood pressure medicine, and it can cause some other side effects that you might not want. For men, particularly finasteride or alopecia has been available for some years now, and then even a topical version is double compounded, and that can be very helpful. And there are all sorts of devices now and treatments like red light, PRP, intradermal drug delivery. These are other ways people can address their hair loss.
And how does hair loss, or how could it impact someone's confidence when you have a patient come in and want to reverse it, or what are they telling you?
Well, basically, we are social animals, and our hair is part of that social signal. It reflects our social status, our health status, our fertility, and so these are things that affect, how people feel about losing their hair.
All right. So again, if someone is experiencing hair loss or have seen it, their hair thinning, a good first stop is the dermatologist.
Yes, board-certified dermatologist, particularly one who is expert in hair loss, is the best place to go to start evaluating your hair loss, because it's not just your diet, it's not just thyroid disease, and it's not just genetics.
All right.
We are able to evaluate all of that.
Doctor, thank you so much for spending some time with us.
Oh, my pleasure.
Dr. Dina Strachan, New York City board-certified dermatologist and director of Aglow Dermatology, talking about hair loss. KCBS News Time, 1:20 Eastern, around